first place. But the record reveals quite a different story. Let's take a look at just a few examples. Mr. David Edmonds of Pinole, California, was operated on in June of 1971 for cancer of the colon, which also had metastasized or spread to the bladder. When the surgeon opened him up, he found that the malignant tissue was so widespread it was almost impossible to remove it all. The blockage of the intestines was relieved by severing the colon and bringing the open end to the outside of his abdomen, a procedure known as a colostomy. 5 months later, the cancer had returned, and Mr. Edmonds was told that he had only a few more months to live. Mrs. Edmonds, who was a nurse, had heard about Laetrile and decided to give it a try. 6 months later, instead of lying on his deathbed, Mr. Edmonds surprised the doctors by feeling well enough to resume an almost normal routine. An exploratory cystoscopy of the bladder revealed that the cancer there had completely disappeared. At his own insistence, he was readmitted to the hospital to see if his colon could be put back together again. In surgery, they found nothing even resembling cancer tissue. So they reconnected the colon and sent him home to recuperate. It was the first time in the history of the hospital that a reverse colostomy had been performed. Mr. Edmonds now is living a near-normal life of health and vigor. In 1967, Mrs. Joan Wilkinson had a tumor removed from her lower left leg, just below the thigh. 4 months later, there was a recurrence requiring additional surgery and the removal of muscle and bone. A year later, a lump in the groin appeared, and a biopsy revealed that her cancer had returned and was spreading. Her doctor told her that surgery would be necessary again, but this time they would have to amputate the leg, the hip, and probably the bladder and one of the kidneys as well. The plan was to open up her lungs first to see if cancer had located there. If it had, then they would not amputate, because there wouldn't be any chance of saving her anyway. At the urging of her sister and a mutual friend, Mrs. Wilkinson decided not to undergo surgery, but to try Laetrile instead. Her doctor was upset by this, and he told her that if she didn't have the surgery, she couldn't possibly live longer than 12 weeks. 5 weeks after starting on Laetrile, the lump in her groin had disappeared. Today, years later, she's living a healthy and productive life. In 1972, Dr. Dale Danner, a podiatrist from Santa Paula, California, developed a pain in the right leg and a severe cough. X-rays revealed a carcinoma of both lungs and what appeared to be massive secondary tumors in the leg. The cancer was inoperable and resistant to radiotherapy. The prognosis was incurable and fatal. At the insistence of his mother, Dr. Danner agreed to try Laetrile, although he had no faith in its effectiveness. Primarily just to please her, he obtained a large supply in Mexico, but he was convinced from what he had read in the medical journals that it was nothing but quackery and a fraud. Perhaps it was even dangerous, he thought, for he noticed from the literature that it contained large amounts of cyanide. Within a few weeks, the pain and the coughing had progressed to the point where no amount of medication could hold it back. Forced to crawl on his hands and knees and unable to sleep for 3 days and nights, he became despondent and desperate. Groggy from the lack of sleep, from the drugs, and from the pain. Finally, he turned to his supply of Laetrile. Giving himself one more massive dose of medication, hopefully to bring on sleep, he then proceeded to administer the Laetrile directly into an artery. Before losing consciousness from the medication, Dr. Danner had succeeded in taking at least an entire 10-day supply, and possibly as high as a 20-day supply, all at once. When he awoke 36 hours later, much to his amazement, not only was he alive, but also the cough and pain were greatly reduced. His appetite had returned, and he was feeling better than he had in months. Reluctantly, he had to admit that Laetrile was working. So he obtained an additional supply and began routine treatment with smaller doses. 3 months later, he was back to work. Since Laetrile was developed in 1952, there have been literally thousands of similar case histories reported and documented. And when all these are viewed as a group, they begin to take on the form of numerical statistics, which of course are more meaningful than individual cases. There have been at least 26 published medical papers written by well-known physicians who have used Laetrile experimentally in the treatment of their own patients, and who have concluded that Laetrile is both safe and effective in the treatment of cancer. The American Cancer Society and other spokesmen for the medical establishment would have us believe that only crackpots have endorsed this conclusion. But the doctors who conducted these experiments and those who share their conclusions are not quacks. Here are just a few of the names. In West Germany, there is Dr. Hans Nieper, director of the Department of Medicine at the Silbersee Hospital in Hanover. He is a pioneer in the medical use of cobalt and is credited with developing the anti-cancer drug cyclophosphamide. Undoubtedly, he is one of the world's most famous and respected cancer specialists. In Canada, there is Dr. N.R. Bouzian, Director of Research Laboratories at St. Jean d'Arc Hospital in Montreal. He is a member of the hospital's tumor board in charge of chemotherapy. Also, he is Dean of the American Association of Bioanalysts. In the Philippines, there is Dr. Manuel Navarro, Professor of Medicine and Surgery at the University of Santo Tomas in Manila. He is distinguished internationally as a cancer researcher and has over 100 major scientific papers to his credit, some of which have been read before the International Cancer Congress. In Mexico, there is Dr. Ernesto Contreras, who for over a decade has operated the famous Good Samaritan Cancer Clinic in Tijuana. He is one of Mexico's most distinguished medical figures. He received postgraduate training at Harvard's Children's Hospital in Boston. He has served as professor of histology and pathology at the Mexican Army Medical School and as the chief pathologist at the Army Hospital in Mexico City. In Belgium, there is Dr. Mason of the University of Louvain. In Italy, there is Dr. Giudetti of the University of Turin. In Japan, there is Dr. Sakai, a prominent physician in Tokyo. And in the United States, there are such respected names as Dr. Burke of the National Cancer Institute, Dr. Marone of the Jersey City Medical Center, Dr. Krebs, who developed Laetrile, Dr. Richardson of San Francisco, and many more from over 20 countries with equally impeccable credentials. These researchers have reported that most of their patients experience several important side effects, including an immediate lowering of blood pressure, improved appetite, an increase in the hemoglobin and red blood cell count, and above all, a release from pain without narcotics. Even if the patient has started Laetrile therapy too late to be saved, this last effect is a merciful blessing in itself. In the United States, if a doctor wishes to avoid being labeled a quack, he must practice what is called consensus medicine. In other words, he must use only those treatments that generally are also used by his colleagues. At the present time, in the field of cancer, those are limited to surgery, X-ray, and drugs. For comparison, therefore, let's turn now to the results and benefits attained through these so-called orthodox treatments. As we shall see, surgery is the least harmful of the three, and in some cases, it can be a life-saving stopgap measure. Surgery also has the psychological advantage of visibly removing the tumor, and from that point of view, it offers the patient and his family some comfort and hope. However, the degree to which surgery is useful is the same degree to which the tumor is not malignant. The greater the proportion of cancer cells in that tumor, the less likely it is that surgery will help. And the most highly malignant tumors of all generally are considered inoperable. The statistical rate of long-term survival after surgery is, at best, only 10 or 15%. And once the cancer has metastasized to a secondary location, surgery has almost no survival value whatsoever. The reason, of course, is that, like the other therapies approved by organized medicine, surgery removes only the tumor. It does not remove the cause.